Kevin Cotton. We have some good guests today. We have to have Dr. Wayne Lipson with us again today. And we also have a special guest, Mr. Charlie Kington. So it's good to be with you today. Good morning, Brecken. I love all the videos you send me. It's funny to watch you.
Good morning, and we definitely appreciate our guests being with us today. We've got some pretty exciting news that we're going to hear from some of those. But one of the things we want to make sure that we kind of get out real quick is that here in the city of Madisonville, we're going to be doing some maintenance work over on Whittington Drive. That's going to be at the intersection of Cross Street and Whittington. We're going to be replacing a culvert there, so that is going to be closed to all traffic. It's scheduled to be February 4th and February the 5th. The rain dates are on the 8th and the 9th. So if something happens and we're not able to get that completed, then you'll see that close on the 8th and 9th.
It's kind of nice to talk about road work instead of coronavirus every once in a while, isn't it?
Yes, it is. And, you know, we've got a lot of things going on, just like you do out in the county. There's been a lot of projects that's been happening even during the coronavirus. But we've had a lot of calls and questions about Whittington Drive. So if you'll visit our Facebook page, you'll see a map, and it'll show you exactly where that work is being done.
Yep. So the world does keep turning, but we are here to talk today mostly about the virus and the vaccine. So right now we have two regional vaccine centers in this area that are working on the 1B, which is mostly the 70 and up age group. We've already covered most of the 1A. If there are some 1As left, you need to get a hold of the health department, and they will get you taken care of. But the 1B, those 70 and up, you can contact Baptist Health in Madisonville. Go to scheduleyourvaccine.com, and you can get scheduled for that. They're working on a phone line, and I'm sure we'll hear some more information from Dr. Lipson, but they're working on a phone line where you can possibly make an appointment. And the schedule builds out as the hospital gets more vaccines. You know, if you've heard the governor, all he keeps talking about, we have three problems: supply, supply, supply. He said that over and over. We just don't have the vaccines that we need to get everybody covered as quickly as we'd like. But as more come in, the hospital is building out that schedule. And so if you're encouraged to check that frequently, because as people may cancel their scheduled vaccine, you may be able to slip in there. Or your primary care physician may be able to assist you in getting you scheduled for that vaccine. Second, we have the Christian County Health Department at the Bruce Center. For that, you can go to kycovid19.ky.gov. You can go to Healthcare Labs tab, and you will see a vaccine locations for healthcare providers. And this is still 70 and up now for Christian County as well. But if you click on the view map, and there are some pins on that map, if you hover over Hopkinsville and click that, then you can register online there. And again, there are more folks looking to get the vaccine than there are vaccines available. So if you can't get scheduled at the time you go, keep checking back on that site, just like the one here in Hopkins County. And as openings come up, you'll be able to get that scheduled.
You know, one of the big things that we hear about the way that this is kind of set up right now with everything being online is, well, my 70-year-old doesn't even have a computer or access to a computer. And that's why your family physician, if you'll reach out to them, they will be able to help you with that process and hopefully be able to get you that appointment. So there are still those alternatives, and then we'll hear from Dr. Lipson here in just a minute about kind of where we're at on the Baptist side for the vaccine call center.
And if you have someone in your family that doesn't use a computer, you know, my dad is super intelligent, but his laptop was a yellow legal pad and a calculator, and he could do some amazing stuff with that laptop. But I had to help him get signed up to get the vaccine. So if you have family members that may not be computer savvy, reach out to them, help them get scheduled.
Absolutely. So to kind of give you an update on where our numbers are right now, so the coronavirus numbers that we've had from the very beginning, from our very first case, our total is 3,608 total cases. That's up 105 from last Wednesday. Our deaths, unfortunately, continue to rise. We've had 3 additional deaths since last Wednesday, so that puts our numbers at 120. So we ask that you continue to remember all of those families that are losing loved ones to this virus. The recovered cases is 2,698. That's up 411. So that's a really good number to see that we have those recovery cases continuing to climb, which leaves our active cases at 790. So last week, if you remember, we were at 1,099. and this week we are at 790. So that was a drop of 309 in our active cases. So that is refreshing, but at the same time, it's not a green light to say go. We know that there's a really big game. There's something going on this weekend. Not sure you all were talking a little bit about that before the show started, basketball or baseball or something. And what we're encouraging is to continue to remember that as you get together in groups, that is how this virus spreads. So remember to use social distancing, wash your hands, wear your mask, and use hand sanitizer. So we'll kind of hear a little bit more about that from Dr. Lipson as well.
So we talk about the numbers and the vaccine and everything that's going on, but today we have an expert that actually knows all about this and what's going on with it, as much as can be known with the virus that's been around for a year now. So we're still learning, but let's go to Dr. Lipson and see what he's got for us today.
He's just excited that we finally learned how to pronounce his name.
Well, yes, good morning. Well, exciting to report as of this morning, Baptist in Madisonville has placed 5,615 shots into arms. So that's exciting since we've started vaccinating. So the majority of that is basically the people, the 1As and now the 1Bs, which is ongoing. You're correct. We are still working on a phone number for people to call, but as you had stated, talk to your primary care provider, and they can help you attain that. Also, if you call the health department, they are making a list of those people that are 1Bs or 70 and greater, and they have been forwarding that to Baptist, and they're getting those patients scheduled as well. So we recommend people do that. It is incredibly important to get vaccinated, but once you get vaccinated, that does not at this point allow you to let down your guard. You still need to wear the mask, you still need to wash your hands, and you still need to socially distance as much as possible. The mayor had asked me a little bit earlier about this new variant that's out there. We do know that at this point, the Moderna vaccine as well as the Pfizer vaccine are considered effective agents against these variants. Right now, there's 3 that we know of. There's the UK, and that's not University of Kentucky. That's United Kingdom. There's the South African variant, and then there's a Brazilian variant. So far, as I say, the studies have indicated effectiveness against those strains. But because that is around, we have not seen it here in Madisonville as of yet, but my understanding is there has been some cases in Evansville. So it's a matter of time. And this variant is a lot more contagious and has been demonstrating a lot more symptoms and difficulties with that. So again, it's imperative more than ever to get that vaccine when you're able to get it, and again to wear the masks and wash your hands and socially distance.
So I have a question on the vaccine. You gave a number of vaccines that have been given out. Is that individuals, 5,000 plus individuals that have been vaccinated, or is that total shots, which would mean about 2,500 individuals?
Now, it's probably closer to 2,500, but not everybody's gotten their second shots in. So it's 5,600 shots in arms. So maybe, like you said, it may be someone who had gotten their second shot, but that's still an impressive amount. And my understanding is this morning that the state will be supplying us the next few weeks with vaccines, so we can continue to take care of our community in getting the vaccines.
Any word or update on the health department and whether or not they've been able to receive any additional vaccines? Have you heard anything?
I have not at this point. I know that we have it's almost a daily or every other day call with the state, and they're going through what's being given out. So I do not know at this point what the health department has been receiving, but we certainly, again, for the 1As and if there's 1As left, and certainly 1Bs, we're going to be able to take care of that for the community.
And hopefully we'll get the Johnson & Johnson, AstraZeneca, and there's a few other vaccines that are in development. Some of them have higher effective rates, but, and correct me if I'm wrong, but my understanding is the effective rates means that it's considered effective if there are no symptoms. But from the research I've done, even the ones that are 65% effective or whatever that number is, even if they had symptoms, they were much milder. And I don't think there's been any deaths that have occurred in somebody that was vaccinated and then had that 2-week period or whatever it is for it to take effect.
You know, I don't know that there's enough research out on anybody that has contracted COVID following, vaccination in an appropriate time to elapse before they get the virus. That is, in other words, after, for example, with the Pfizer vaccine, after 7 to 10 days, you're considered, and this is the second shot, you're considered immunized. With that, it's effective 94 to 95% of the time, and with Pfizer and maybe about 94% with Moderna. But your point is absolutely correct. You can still contract the virus if you've had a vaccine. However, the symptoms and the complications that one may get are much less. And that's the difference. It's no different than a flu vaccine. You can still get the flu, but what you're going to get as a result in issues resulting from that are much less. So it is. So in that sense, you're right. So that is effective. So that's what you want. You want to reduce the symptoms, and that's the problem with COVID. Is that, and again, I've said this on this show, is that it's not the COVID that necessarily causes death. It's the reaction that the body does to fight it off is where we get, which causes the death. So if we can control it with the vaccine, then we're going to be a lot better off.
Dr. Lipson, I want to say from the city of Madisonville how much we appreciate you being willing to come on and give us updates and give us, kind of what's going on at Baptist and even with the vaccines, kind of keeping us up to date on that. And I know that as we move on and we start changing kind of how the show is going to go again, as we did earlier in the year, we're going to go to once a month is our goal right now. But I know that this community appreciates what you all have done to keep them well informed on what's going on and how that they can stay safe. So thank you so much. I know that we'll probably have some questions for you here in a few minutes, but I just want to say thank you for all that you all have done in communicating with us and keeping us informed.
And I would like to add that we thank the community because the outpouring of support over the last year, in support of our healthcare workers, our doctors, our nurses, our therapists, anybody that's been in that facility, over the last year and having to take care of patients, it's been very uplifting when the community comes by and the churches come by and they're bringing food and they're bringing stuff for the staff, because obviously the staff has worked so hard, in this past year without letting up, and that's just a testament to them. And I can tell you, I still think back to when you were out there with the whole community, with the trucks and for everybody from Madisonville, and to wave to the healthcare workers. That meant so much to everybody in this battle that we've been involved in.
Well, the healthcare workers have certainly had a rough year, and we appreciate all they've done. But we've talked quite a bit about how, especially small businesses, have had a rough year. And today we've got Mr. Charlie Kington with us to talk about maybe some help that's out there for some of the small businesses. So, Mr. Kington, you got some information for us today?
Thank you, Judge. I hope everyone can hear me pretty well. My name's Charlie Kington. I've been a CPA for, since 1986, and been practicing in public accounting since the day I turned 22. So I've been around for a while. I think this is either tax season 38 or 39. If you are familiar, what I'm going to address today is that if you're a farmer, if you're self-employed, if you have employees, if you own a business, okay, this is what this discussion is about today, and it's fairly technical, but we're going to make it as easy as we can because it has to be easy for me to understand it. When the former President Trump signed a tax bill or signed a COVID relief bill December the 27th. I didn't think a whole lot about it because I didn't know what was in it, and I was like, okay, well, we got another one. The first PPP loan that was passed was back in March that he signed, and those PPP loan requirements went through 23 revisions. They changed everything over time, and it was really frustrating for the accountants, but we got through it. Now they have come up with something called a second draw or second helping PPP loans. Now, to qualify for a second helping PPP loan, you have got to demonstrate a 25% increase either annually or by quarter to quarter, gross receipts, okay? Difference between 20 and 19. So if you have that, then you're going to be qualified to prepare another PPP loan application through your local financial institution. And the local financial institutions have been really good to work with around here and have made those loans. Sorry, I will get that out of the way. Now, reversing one thing, this tax law had a provision in there that allowed farmers, and farmers only, self-employed farmers, because a lot of those folks, but after they do depreciation and they have fuel and inputs and those kind of costs, a lot of those folks didn't make any money. And in the first PPP loan, if you didn't have a profit, you couldn't get a PPP loan. So I said, okay. Well, they changed it, and of course they did. And we will apply it. And now they're going for gross income on your farm and actually gross receipts. So if you actually buy cattle and sell cattle later, you take line 9 of the Schedule F plus line 1B, if there is something. You take that number, divide it by 12, multiply it by 2.5. Okay? Now, getting back to the second helping PPP loans for the businesses is that if your standard industrial classification SIC code on your tax return starts with a 72, you're a restaurant. Chances are, if you're a restaurant, your revenues have been down. And we always had done, you could either take 19 or 20's payroll, whichever was higher, take that number, add in employee costs such as health insurance, state unemployment, a few other things, and then you would take that number, divide it by 12, and multiply it by 2.5, and that would be your second PPP loan. However, if you're a restaurant, you get to multiply that monthly average by 3.5 for those targeted folks. Now, what I'm going to talk about now is something a lot of people don't know about, okay? This is called the Employee Retention Tax Credit. It came up last year. It was part of the original tax law. However, the Employee Retention Tax Credit said if you took out a PPP loan, you can't take advantage of the Employee Retention Tax Credit. So we're like, okay, well, pretty much most of our businesses and everybody else took advantage of the PPP loan, so they weren't qualified to take advantage of this. Well, guess what happened December 27th? They changed their mind, changed the law. Now you can do this. So this is a big deal. This is a huge deal. It's even bigger for 21 than it is for 2020. To qualify for this is that you had to have, you can take out a PPP loan, excuse me, let me start back. To get the ERC credit, which is what I'll keep calling it, is that to get that credit, you can't have used the same wages that you're using for the credit that you use for the PPP loan. So, for example, let's say on the PPP loan, you applied for it originally and you had $200,000 in wages, and when you did your forgiveness, you used $150,000 of those wages in your calculation. Well, in this case, $50,000 would be eligible for the ERC credit. Now, you don't think much of it, but it's a 50% credit. The one for 2020 was 50% on the first $10,000 of everyone's wages for the year. And trust me, this gets better in 2021. In 2020, you either had to have your business fully or partially suspended or shut down, at least one quarter in 2020, or you had a precipitous drop. That's a big word, precipitous drop in gross receipts for the quarters in 2020 relative to 2019. So the precipitous drop is about 50%. So you either were shut down by state law or you had your revenues essentially decimated. So that was the harder part. A lot of people, we don't think a lot of our clients are going to qualify for the ERC on the first go around for 2020, except possibly maybe 10% of those folks. Now, for 2021, big difference, big change. We're probably going to see, I'm going to think 70 or 80% of our folks are going to qualify for this ERC credit. Now, for 2021, all you have to do is meet the threshold. You either have to be obviously shut down one sometime during the year, or two, you had to have your revenues less than 80% of not 20 of 2019. So you compare 2019 to the first quarter of 2021, and naturally it's probably going to be down. So that credit is, if you qualify for that, then the credit is 70% of the wages. That's a big number. 70% of the wages is a tax credit. That means a refund for up to $10,000 per employee per quarter. So theoretically, now this only lasts for the first 2 quarters right now. It probably will change. The first 2 quarters of 21. So you could have someone who earns $10,000 in each of the 2 quarters. Well, they would get $20,000, and the tax credit, the money coming back to you, would be $14,000. Well, if you've got 20 or 30 employees, that's just an absolute huge number. So don't turn your back on this. And unfortunately, what you're going to have to do is that you're going to have a fairly good tax advisor, or you have to have a wonk in your office who understands this stuff and how to apply it and interpret it for your benefit. A couple of things. Now, we talked about fully or partially suspended due to orders from the appropriate governmental authority. That's pretty easy. And then once it occurs, then the wages for that quarter count. Now, the employer we were talked about had to be damaged in 20, is it had to be less than 50% of what the same quarter was in 19. Of course, in 21, that threshold has been raised from 50% reduction to only a 20% reduction, the inverse of 80. So a lot more folks are going to qualify for it, and they're going to qualify for it for a longer period of time. I can't get into the details of this because if we did, I would probably be here for probably an hour and a half going through all of the details. So the first thing you need to do is that you need to identify that you have a eligible quarter in 2020 or 2021. Now, let me say this for 2021. They have a Form 7200, which is an advance credit of this. It's kind of like, you remember how you had on the Obamacare, you had the advance credits so that your net health insurance premium wasn't very much, and then you reconcile at the end of the year whether they owed you, you owed them. Well, in this case, you can take the advance credit. I'm almost recommending to all our clients not to do it, to go ahead and pay their payroll taxes on their 941 like they always have. And then we're going to have to go back probably in the summer, we're thinking, and amend everyone's 941 form and ask for a refund. But this thing is huge. It's going to be big, and it's just as big as the PPP loan, which turned out to be very popular. Everyone loved the PPP loan because the money was absolutely tax-free. So you didn't have to pay any of it back, and you got to deduct all the expenses with it. So it was sticking money in your pocket good. PPP2 will be the same thing, the second round of those. So we have prepared a lot of second draws applications. We have prepared a lot of first draw applications for farmers of late, and so there's a lot of activity in that area. So don't don't overlook these credits because they're huge.
So Charlie, one of the things that we saw from a lot of businesses on the second round of PPP was they didn't qualify for those funds because the way that the executive orders came down from the governor was it shut down mid of March, which would be the first quarter of 2020, and then continued through the second quarter of 2020, but then eased up to 50% to allow for some of those businesses to start opening back up. So they were unable to meet that 25% loss in one single quarter because it was split between the first quarter and the second quarter. But that's not the case in what this tax credit that you're talking about now on the payroll tax. So this is really going to be big for a lot of those businesses in our community that were disappointed because they didn't meet those qualifications for the second round of PPP, and possibly going to help a lot of those smaller businesses that are struggling to stay open as we move forward through this pandemic.
There's no question, Mayor, that it's probably the biggest, you can't say giveaway, but it's assistance and help, and you know, the federal government's trying to help everyone, and they're trying to keep it on a level playing field. But there are a lot of folks that really don't probably need it that are getting it, and a lot of folks that probably need it that don't know it's out there, which is really sad. But anyway, that's but to answer your question, Mayor, yes, there was a lot of folks that probably didn't qualify for the PPP reduction, and for the second one especially, but when you got to looking at it, every quarter it could change. I mean, I had a construction company that actually looked slightly more money in 2020 than they did in 2019. However, one of the quarters, i.e. the second quarter, which is what it is for most people when everybody the virus was really raging, they were down 25% that quarter compared to 19, so they qualify for the whole year and get a second PPP loan. So get some help with this. This is not easy stuff, especially the employee retention credit. It's very difficult, but it's very, very rewarding. So I've been very happy, and it's been easier for me when you give a client an invoice for your services and you say, remember that PPP loan you got? Yes, I do. Thank you very much. Okay. Well, you remember that ERC credit, enhanced employee retention credit? The employee retention credit? Yes, I do. Okay. We are still struggling with the employee retention credit in our practice, and we are just time crunched to the max because we had compliance month last month, so we had to get all of the W-2s and 1099s for our clients, helping with those, and we had to do a lot of second round PPP loans. So now we are wrestling with the idea of saying, do we try to do this employee retention credit calculation and get it in on the first quarter of 2021 and do all those computations? I think we're just going to wait until we finish with our tax rush.
So I'm going to make a recommendation here. If you have a small business or a farm, or if you've lost income due to the coronavirus, call your local friendly CPA and see what kind of help may be out there for you.
Yeah, or whoever's doing your taxes right now, reach out to them and find out if you qualify for those funds. Because what we want is we want those funds coming back into our community, coming back into our businesses to help secure those businesses for the future of our community.
And just looking at Sarah, I'm betting we have some questions out there.
She seems like she's ready with some questions.
Great. A couple questions on utility companies being able to issue late charges and cutoffs, and if there is any assistance out there for those that may be struggling.
So yes, the governor actually opened that back up. I think it was the first part of November, if I remember right, maybe the second week of November, to allow the utility companies to do that. I know here in the city of Madisonville, what we did was we chose not to do it in November, knowing that we were coming up into the holidays. We wanted to make sure that we were working with our customers, and we pushed that off to the middle of January. And so we have just started that, and it's been very successful actually, as we've been working with our customers, trying to work on some budget billing and things like that so that we can get caught up on any past due bills that are out there, but there is some funds that are available. We are applying for those funds. We have not received those yet. That is being done and will be done through PACS once those funds come available in our community. But no matter what community you live in the state of Kentucky, your utilities do have those funds that will be coming to them if they apply for them. And there should be notification from those communities on how you can apply for that, just like there will be for us. Once we receive those funds and we know exactly what that process is, we'll push that out to you so that you have access to it.
But yes, cutoffs are allowed. So if you are struggling to pay your bills, contact your utility company. Let them know that you've been affected and that you want to work with them and make whatever payments you can to try to ensure that you keep that service on. Most of the utilities I've talked to, that communication is key. If they know that you've had a negative effect, but you are going to try to get that bill caught up, and you work out payment plans, they're going to work with you. They don't want to cut anybody's power or water off. So communicate with your utility company.
All right, Dr. Lipson, a question for you regarding the vaccines. Does Baptist have a standby list for vaccination shots for people that may not show up, like a last-minute cancellation to where someone could pop in? If that occurs, then who would be permitted to sign up on that list?
Again, if there's cancellations, as you had mentioned, we have things coming in from the health department, list from them, and that's where a lot of those are getting put in, as well as from primary care. So they have those lists. I mean, there's not a standing list that somebody's keeping per se.
Great. If someone missed their A1 vaccine, they've called and left messages at the health department, would there be another recommendation for who else they should reach out to?
Call my office. If you are 1A and you can't get a hold of the health department, get a hold of me and we'll get something set up.
Several communities around us are having issues providing doses for the second shot. Is that something that we are addressing here in Hopkins County? Has it been a concern?
Not to this point, because when people get their first shot, the state has already said that you would be getting those vaccines for the second shot. So, for example, we got 2 batches this week, in which means that ones are for new shots for the 1Bs or the 7Ds and over, and the others are for those people that are coming up on their second shot. So that is not an issue at Baptist thus far.
And that's another benefit that we have in our community by being a regional vaccination site. Is that correct?
Absolutely. That is correct.
Great. Do we have a time frame that the next group may begin, and once this tier could be complete? Any
Well,
kind of guesstimate on that?
That's all going to depend on the supplies. I mean, we know we're getting somewhere between 1,000 and 1,500 a week. Is that still accurate?
Yeah, that's correct.
And it's supposed to go up about 22% from what the governor said the state would get. Now, I don't know how that's going to roll into Baptist, but as those numbers go up, and I think you're probably still scheduled out at least 3 weeks with 70 plus.
Correct.
So before we hit that 1C, to me, common sense says it's going to be at least 3 weeks before we start dipping into that at least very much.
And what was the one thing? There was 3 things that the governor said that was our biggest challenge. What were they?
Kevin. Oh no, supply. Sorry. Yes, it's supplies. That is what's holding back
It
the
was
vaccine.
supplies. Yes. Thank you for answering that correctly, Judge Whitfield.
I think if you could just respond to close us out with the websites that they can go to continue checking back for scheduling vaccines.
Okay, so for Baptist Health here in Madisonville, that is scheduleyourvaccine.com. Again, scheduleyourvaccine.com. I don't know if we have a graphic up for that or not, but the second one is the Christian County Health Department is doing their regional vaccination center at the Bruce Center, and you would go to kentuckycovid19.ky.gov. With that one, you have to choose the Healthcare Labs tab, and then choose your location. So that one might be a little tougher to navigate, but definitely the Baptist Health, scheduleyourvaccine.com for here in our community.
And again, when you go to those sites, it's probably going to show that there are no appointments available. But as appointments become available, you need to go back and check to see when that happens. Continue to go back and look at that site very frequently. And if somebody cancels or more vaccines come in and places open up, then you'll be able to get scheduled.
And we know that everybody that is getting those vaccines are really anxious to get those vaccines. We just ask that you understand to kind of follow those guidelines. If it says 70 and over, please fall within that guideline and understand that if you're in your 20s and you're trying to apply for that vaccine, you're taking that away from somebody that's in that 70 plus category. And what we don't want is we don't want to jump ahead of line and take away from those that are identified as the most critical in need. And so please be patient as this process rolls out. This is not just a rollout in Madison, Hopkins County. This is a rollout nationwide. It's a vaccination nationwide. So work with us as we're trying to work through that. I know that Baptist Health has done a fantastic job being able to get those numbers up quickly. And again, we know that there's a big sports event going on this weekend. Keep those groups very limited. Wear your mask, wash your hands, use hand sanitizer.
And be careful. And Mayor, so we've been doing this for almost a year now. And I can't tell you how much I appreciate being able to come over here and do this update and your willingness to help get information out and bring in guests like we've had today. And I think it's worked very well to inform the citizens of Madisonville and Hopkins County of kind of what's going on and keep them up to date. And we started out, I think we had 1 or 2 meetings, and then the virus was spreading faster and faster, so we went every day, and then it started to slow back down, so we went to once a week, and that's where we've been for, what, eight months now?
It's been a pretty good while. And, a big thank you has to go out to our entire team here in the city. We've had our own Kenneth and James with us throughout the whole process. And then, of course, Miss Sarah has done a fantastic job making sure that we have all the information that we need that we can get out to you, and then getting those questions to us. So it has truly been a community effort and a team effort to be able to get this information out to you.
So as things have changed over the last year, we've ramped up or slowed down the schedule we're meeting, and now things seem to have stabilized. Not meaning that the virus is not still out there and causing issues, but the changes that are taking place have stabilized. So we're going to back up and do this, what, you think, once a month now?
I think once a month is what we talked about. So our next update will be on Wednesday, March the 3rd. And then we'll kind of transition into that once a month to kind of see how that goes. And if we see that things are ramping back up, then we will ramp back up to our weekly updates. And if need be, then we'll do something different even with that. But and if there's breaking news that comes out that we need to get out quickly, then we will put that out on social media for you to watch for a breaking news update. That way, because we want you to understand that we want to keep you as well informed as possible. And but at the same time, we want to make sure that we're giving you pertinent information that's going to apply to what's going on.
So again, Mayor, thank you for everything you've done over this past year to help keep people informed. Dr. Lipson, thank you for being with us so often and helping get out that actual expert information. Mr. Kington, thank you for being on with us today. I know it's an important piece of information to get out to the public, especially those small business owners and farmers. So I'm sure your phone will be ringing even more than it has been. So everybody have a great day, Brecken. I'll talk to you later.